So,
Yeah. Okay.
Darla, good morning. How are you today?
Good morning. Doing well.
Great, great to hear. I really appreciate you taking a few minutes out of your hopefully now pleasantly busy schedule to chat. We're just going to go very quickly through your history, which is really amazing in that you've had headaches for over 6 decades, or about 6 decades now. Is that right?
That's correct.
Ever since you were 4 years old?
Yes.
All right. And in that 60 years, what was the working diagnosis with everything?
They claimed that I had migraines. I had an EEG when I was age 7 because I was obviously having something go on, and that's what they concluded with. And all these years, that's just the basis they went by.
And so you were treated for migraines for that entire time,
Correct.
right? And you'd been on dozens of meds over the last over half a century,
Hmm.
um, all sorts of injections, so on and so forth. We actually met for the first time about 3 years ago, 2.5 years ago. And then there were some other medical issues going on with you. So we ended up meeting for the second time, literally just over a year ago. And we ultimately determined that you had occipital neuralgia with just a couple little nerve blocks, right?
Hmm.
And that was the first time in recent memory that you'd had any relief from your symptoms, right?
Right. With the steroid injections, it was a temporary relief,
Mhm.
and obviously that was just a coming and going thing. It would hurt really bad, and then do a little better, and then of course right back to cycle to enormous pain. So
Right.
pretty much timed out on that. It didn't help me after a while.
Yeah, yeah, and that's very common. But when we did the blocks, which are intended to be temporary because the local doesn't last long, you had good relief, right?
Right.
And so steroid injections are again things that people try, and in your case, like in most cases, work temporarily. So
Hmm.
ultimately, we did an operation on your greater, lesser, and third occipital nerves on both sides. That was a year ago tomorrow.
Hmm.
Um, let's just cut to the chase. Where are you today with regard to your symptoms?
I am 100% better, and I'm very, very excited to say that. Very excited.
Yeah.
The in my life is just crazy.
So let's talk about that. I mean, I think that's really what I think is most important for you, and obviously most gratifying for someone like myself, aside from being able to say I don't have that pain that I've had for 60 some odd years.
Mhm.
Tell me how this has changed your life.
Well, it becomes such a crescendo that with repetitive head injuries and falls, that the pain was so bad that concentrating, conversating, anything of that nature was just incredibly painful, difficult. Even at to a point where I had to be put into a can't have TV, can't have stimulation, anything. The head was so intense with the pain and the injury and the resultant issues from that. So basically, everything has changed, of course. I mean, I can concentrate, I can think, I can drive, I'm a painter, looking around the room.
I was about to ask you about
I,
that.
it's absolutely full of paint and painting again, and I'm really, really happy with that. I'm a retired nurse, and I really feel like the care that I got and the ability for you to put your finger on it, say I can help you, and you also I also feel like what really helped me through this whole process is you gave me really clear expectations of what it would be like.
I
And I
appreciate it.
think that for me, who's very practical minded, that was very helpful because I could hang on to that, because afterwards it is going to hurt more. It is going to fire off more. It's going to just, you're going to go, why did I do this? But I just always really had faith that that was a healing pain. And
Mhm.
everything you told me, it'll go to here, it'll go to here, it'll fade out. And everything you told me was spot on. And I'm just 100% satisfied that you helped me where no one else would, could, or um you know just it's just amazing I went through my life that long
Yeah.
and so badly,
Sorry.
and don't at all, not at all.
Um, well, I mean, I'm obviously so incredibly enthralled for you and so happy that you're doing so well. Your paintings look phenomenal. I'd love to come see your studio one day. I'd love to give you the last word if you have anything else you want to say, but I just wanted to say I really appreciate you sharing your story and, telling people that even if you've had headaches for a very, very long time,
Mm.
surgery can still be effective.
Yes, very much so. And I just like to say that just appreciate the fact that you will not be alone through this, and that everything you're told, expectations will bear out, and that your practice is awesome. I'm just very, very pleased that my neurologist timed out and sent me to you, because thank God. Thank
Yeah.
you.
Yeah. I really appreciate that. Well, you have a great day. Enjoy your
All right.
weekend and enjoy some painting.
All right. I will. Thank you.
Cheers. So.